There are many things you can do to slow down wrinkles, such as taking collagen peptides, eating a healthy diet, and getting enough sleep. But none of them increase collagen synthesis by 400%. I'm talking about microneedling, which has been seen to increase collagen and elastin in the skin by 400% after 6 months, as shown by this 2022 review. In this video I'm going to talk about the science behind microneedling and why it just might be the most effective way to slow down skin aging. Make sure you watch until the end where I tell you how to do microneedling correctly, because there are some pitfalls that you can fall into. First, let's talk about what is microneedling in the first place. Microneedling is a dermatological technique that causes microtrauma to the skin with small needles on a derma rolling device that then triggers collagen synthesis and skin repair. Microneedling can be done with a derma roller, which is this rolling device with mini needles on top, or with a derma pen, which is like a pen that shoots the mini needles into the skin. To be honest, when I first heard about microneedling, then I was quite skeptical. I thought, no way this can be real. But then I read through the clinical studies done on derma rolling, and I also tried it out myself. And I must say that the effects are quite amazing. In this 2018 study, they took 40 people between the ages of 33 and 60 with aged skin from either smoking or general aging. They gave them a dermapen treatment for 6 sessions. The results showed a statistical improvement in skin wrinkles, fine lines, and crow's feet. The results were seen in both men and women, and in both smokers and non-smokers. Like I alluded to, microneedling can increase collagen synthesis in the skin by 400%. I think, as you know, collagen is the main protein inside a human body, especially in the skin, and you need collagen to maintain skin firmness. However, this 2014 study found that microneedling once a week for 4 weeks increased epidermal thickness by 658%. That's massive and pretty much unheard of when it comes to anti-aging supplements or something else like that. Not only does microneedling reduce wrinkles, but it also reduces pigmentation of the skin and improves aesthetics. Microneedling for 60 days has been seen to improve pigmentation disorders. The microneedling lightens skin stains in patients with melasma. This has an obvious aesthetic effect, making the skin look younger and less photo-damaged. There's also acne and skin scarring. Microneedling has been seen to improve skin scars, including acne, by increasing the production of collagen, elastin, and increasing the thickness of the skin. In this 2015 prospective clinical trial, they took 10 patients with different acne scars and gave them 6 microneedling treatments over the span of 3 months. The patients collectively reported a 51 to 60% improvement in scar appearance, 40 to 50% improvement in skin texture, and 80 to 85% overall satisfaction. As you can see from left to right, the participants saw some improvements in their acne scarring, with some seeing more results than others. In another 2014 clinical trial, they combined subcision microneedling and 15% TCA peeling to 50 patients with atrophic acne scars, alternatively at 2-week intervals for a total of 6 sessions of each. Out of 16 patients with grade 4 scars, 62.5% of the patients improved to grade 2 and 37.5% improved to grade 3 scars. Out of 22 patients with grade 3 scars, 22.7% were left with no scars. 9.1% patients improved to grade 1 and 68.2% of patients improved to grade 2. All patients with grade 2 scars were left with no scars, and overall the level of patient satisfaction was very high in this study. These are some quite amazing transformation photos. I've never had acne or any serious skin scars, so I don't know if it actually works for my own experience. However, I do have like a mini scar right between my eyebrows that you can see sometimes that happened from a branch that hit me right between the eyebrows, luckily. And there is like a mini scar. I have seen some improvement when I'm doing derma rolling. So you derma roll this scar here and the scar has gotten slightly smaller over the course of a few months. Microneedling was first introduced in the 90s to treat scars, but it's also been used to deliver drugs to the skin, as well as enhance the bioavailability of some active ingredients like peptides, vitamin C, collagen, and retinoids. The idea is that micro-sized needles can pass through the outer layers of the skin, which creates microchannels that enable these compounds to get deeper into the skin and have more effects. That's why when it comes to skin rejuvenation, microneedling has better effects if you combine it with some other compounds. In this 2018 split-phase comparative study, they took 24 volunteers with photo-aged skin and randomly divided them into 3 groups. Number 1, derma rolling alone. Number 2, derma rolling plus platelet-rich plasma PRP. And number 3, derma rolling plus TCA 15% peeling. Both sides of their face were divided randomly into the interventions, meaning that the person's right side could have gotten either dermarolling alone, and their left side could have gotten dermarolling plus PRP or dermarolling plus TCA peeling. So you have a comparison of the one single individual. They received one session every 2 weeks for 6 sessions in total. The results show that combined treatment of dermarolling and PRP or TCA peeling was more effective in increasing skin thickness and reducing wrinkles than dermarolling alone. Dermarolling alone did improve the outcomes, but the results were better when dermarolling was combined with PRP or TCA peeling. Out of PRP and TCA peeling, the PRP with dermarolling appeared to be the best. Microneedling also appears to help hair growth through similar mechanisms. The microneedles damage the skin slightly, which then triggers collagen synthesis. Now, you're not gonna go from bald to Mustafa, but you will see the growth of some small hairs. In this 2013 pilot study, they gave one group 5% minoxidil twice a day, and the second group minoxidil together with weekly microneedling. As you can see from the pictures, the group getting minoxidil alone did see some minor improvements in hair growth, but the microneedling plus minoxidil group saw much more results. Another 2015 study took 4 men with hair loss who were taking finasteride as well as minoxidil for 2 to 5 years already, but they saw no new hair growth. They were then put on microneedling for 6 months. All 4 patients showed +2 to up to +3 improvements on a 7-point scale, and the new hair started showing after 8 to 10 sessions. Again, those are quite amazing results. We don't have that many other clinical trials on the effects of dermarolling on hair growth, but anecdotally some people do say that it does work. The reason microneedling works better with minoxidil than minoxidil alone or dermarolling alone is because dermarolling opens up these channels inside the scalp, inside the skin, that then enables minoxidil to go deeper into the scalp. So microneedling itself is a tool that triggers collagen synthesis, but it also enables other tools, other ingredients to work better. I want to take a quick break to let you know about my favorite wellness devices, which are the Bond Charge red light therapy devices. You've probably seen many of your favorite longevity influencers using these red light therapy devices, but do they actually work? Yes, they do. Red light therapy has been shown to have many benefits on skin anti-aging, hormone optimization, pain management, and even exercise performance. I use my device every day for 15 minutes, especially during the winter months when there's not much sunlight. It increases my energy in the morning and makes my skin glow. Just check out the testimonials on the Bond Charge website for the before and after pictures of other people. Most red light therapy devices don't have the right wavelengths of light, which might mean you're not getting the claimed benefits. Bond Charge uses the exact wavelengths of light used in research, and they also have near-infrared light that's beneficial to the joints. Head over to bondcharge.com and use the code SIIM, S-I-I-M, for a 15% discount. Alright, so now let's talk about the do's and don'ts of microneedling, some easy mistakes you can make, because there are indeed a few mistakes that you could make. First of all, microneedling is considered generally safe, and it is FDA approved for certain dermatological applications. However, microneedling can sometimes cause skin irritation, bruising, itching, redness, or rashes. I've done microneedling once a week for about a year now, and I've never had any issues with it. I've never had any irritation or skin rashes or anything like that. But it could happen for some people who have a much more sensitive skin. Second of all, you need to clean your dermaroller or whatever device you're using. The needles are going to pick up all the dirt and dead skin cells, so you don't want to dermaroll your face with dirty needles. For that, after every time I dermaroll, I put the needles into a glass with isopropyl alcohol 70% solution to kill the bacteria. I keep it there for 5 minutes and let it dry off before I put the dermaroller back into the box. Before you start doing dermarolling, you should also wash your face with warm water. And if you have some sort of a face cleanser or non-irritating soap, then you can wash your face with that as well. You don't want the needles to open up the skin and let the dirt and sweat go into the skin, because it can cause some inflammation and infections. Third, you might wonder which kind of a dermaroller should you use. Well, there's obviously a lot of them out there. There's different types of dermarollers with different types of length of the needles. The dermaroller that I've been using most consistently is the Alitura dermaroller. Its length is 1 millimeter of the needle length, which is kind of effective length. Alitura's dermarollers also have the needle that looks more like a spike rather than a needle, as this one, which I think is Gin Amber, that's more of like a needle as opposed to a spike. Some people say that a needle is better than the spike, but personally I've used both. I don't notice much difference. I'm going to leave a table here on the screen that outlines FDA-approved microneedling devices if you want to try out any of these. However, buying a regular cheap derma roller from Amazon should also get the job done. So what is the optimal length of the derma roller? For treating acne scars, they use longer needles with a length of 1.5 to 2 millimeters, which are twice as long as the needles you'd use for treating aging skin. For regular skin anti-aging, a microneedle length of 0.5 to 1 millimeter is recommended, and that's what I've been using. Some parts of the face are also more sensitive, like under the eyes, which is where you want to use shorter needles of about 0.25 millimeters. For hair, however, you need slightly longer needles of at least 1 millimeter, up to 1.5 or 2 millimeters. It might also be a good idea to start with shorter needles to build your skin tolerance, because if you haven't done it before, then your skin might be much more sensitive towards the needles. But after a while, when your skin becomes thicker, once the collagen synthesis has begun, then you'll be able to tolerate a little bit longer needles. If you want to get more effects, then yes, you do want to eventually gravitate more towards 0.5 up to 1 millimeter of the needle length. The 0.25 eventually isn't going to work. It's not going to be stimulating enough for the skin. However, going for longer needles like 2 millimeter or 3 millimeter, I think most people don't really need to, and unless you have acne scars or some other skin conditions, then you don't really need to have these super long needles, and they can actually be more harmful. And lastly, how do you actually do the derma rolling? Well, first of all, you don't want to press too hard. There's no reason to really push against the skin, because that's going to cause unnecessary damage. So what you're just doing is rolling it over your face. And what I like to do is obviously you cover the entire face, do like a clockwork motions. You do 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. So you're kind of, you don't need to roll it like some sort of a car toy or something like that. You're trying to obviously give every spot the equal amount of strokes or equal amount of rolls. So like 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, kind of like that. That's how I do it. I think that's a pretty reasonable way to go about it. And you don't need to press super hard. Again, if it's too hard, too much irritation, then it can cause more damage than necessary. So you're just easily rolling it over the skin without actually pushing against it. The needles themselves do the work. You don't need to push extra. How often should you do derma rolling? Well, I've been doing it once a week. I think that's a pretty good frequency for most people. Doing it every day is obviously not gonna be that beneficial. Your skin needs time to recover. It's the same as with lifting weights. You don't need to lift weights every day. You don't want to do weightlifting every day. You're just once a week in the evening, you do it, and that stimulates the collagen synthesis for the rest of the week and enables the skin to actually recover and actually get, stronger in essence. Remember that derma rolling is causing microtrauma to the skin that then triggers the rejuvenation process. For your skin to heal and recover, you need to give it several days of no damage. Once a week is good enough. The best time to do derma rolling is in the evening, because then you're not going to go outside into air pollution or sunlight that would start damaging the skin or causing infections. Do it 1 hour before bed after washing your face and go to bed. It would be best if you use some natural pillowcases like cotton or silk pillowcases, because they're much more beneficial to your skin than polyester and artificial pillowcases. You could also apply some serums or hyaluronic acid. Cream after the derma rolling, because as you saw from the studies, derma rolling works better if you combine it with some other treatments, and the needles enable the skincare ingredients to reach deeper into the skin. Now, I wouldn't recommend using some sort of fat or oil-based skincare supplements, because the oil tends to clog up your skin pores, doesn't let your skin breathe that well. So if you do microneedling, you have these microchannels inside your skin opened up, then clogging it up with some fats or oil is not really a good way to go about it. However, if you have some water-based serums, those are much better because they actually absorb into the skin. When it comes to red light therapy, then I've found that doing it immediately after microneedling is quite effective. However, there is the argument that red light therapy also works through causing minor skin damage that then triggers collagen synthesis. So I don't think it's the best idea to do red light therapy immediately after microneedling. Instead, do red light therapy the day after, because then your skin has already healed slightly. And then the red light therapy can provide additional healing effects, so you can recover faster. And to support a recovery every day, it's still recommended to eat a healthy diet and take collagen peptides as a supplement, because they've been shown to improve skin aging by supporting collagen synthesis. So there you have it. Based on the research out there, then microneedling is one of the most effective ways to rejuvenate the skin and have skin anti-aging benefits. It's relatively safe, relatively easy to do, and you don't need to sacrifice that much time for it. It takes me less than 5 minutes to derma roll my face once a week. If you want to know about the most evidence-based skin anti-aging supplements, then check out this video next. Other than that, thanks for watching this video. Make sure to click a like and subscribe for future videos about living longer and staying healthier. My name is Siim. Stay optimized, stay empowered.